say, this is just to sort of do a bit of a promotion for our YouTube channel, which is definitely a very small channel right now. So, guys, let me start the recording and we'll get down to everything that we're doing today. Okay, so this is OET speaking. It's Monday. We're starting a kind of new topic, and we're going to move away from the clinical communication criteria. We've now covered all 5 of those, and also we cover those in the video courses. So, guys, if you want to go over any of those, you can check out the video courses. Today, we're going to look at something a bit more kind of like maybe practical, might be the right word, because we're going to talk about dealing with difficult patients. But I want to just start by just sharing my screen and making sure that you guys can all see the correct thing. Can you all see a picture of an angry guy?
Yes, we can.
Yes.
All right, so I did this last couple of months ago. You might even recognize it. What did you say there, man? Yeah,
he's like an Italian with his,
he looks Italian.
yeah.
Is that because of the hand gesture?
Exactly.
Okay, and obviously you're living in Italy right now, so you would know. Okay, so guys, today what we're doing is we're going to have a quick group discussion at the start. And you're all nurses, you're all doctors. You can probably think about what we should do when we're dealing with difficult patients. We're then going to make a diagram. I've got 6 basic techniques that you guys should all, know about. And then this week, we will be working on them. We might have a little bit of a practice at the end of the class, but really this is just an input session today. That by input, I just mean mostly me talking and asking questions. But tomorrow, the day after that, all week, you'll be practicing this topic. Okay, so let's get started. And I want to start with just a very simple game. I'm going to ask someone to put their microphone on. Who shall we have? Who shall I choose? It would be nice to have someone I know quite well. Maybe Dr. Saki, Emal, Abdullah, whoever wants to come first. You guys would be great. Yeah. Okay, so Dr. Saki, we're going to play a game, all right?
Okay.
You're the doctor. I'm the patient.
Okay.
Okay, guys, it's just a role play. I just want you to listen, see what happens. There's no right or wrong here. It's just an introduction really to this class, okay? So, ready, Dr. Saki? I'm the patient, you're the doctor. And let's say we're in the ER department, okay?
Okay.
Okay, so here we go. 3, 2, 1, go. Excuse me, doctor.
Yes.
I've been waiting here for 3 hours. Can you help me, please?
Oh, that must be difficult for you. Sorry, sometimes, this is quite hard to wait. But now I'm busy, but I will ask someone else to come in to, answer your question.
It's just not acceptable, to be honest. No. I want you to tell me now why. Have I been waiting 3 hours? It's ridiculous.
Yes, it is. But unfortunately, I'm very busy with another patient who's in critical condition. I need to deal with him.
Okay, but that's just not good enough. I'm in a lot of pain right now.
Yeah, I know that. Sorry to hear that, but I will ask somebody else to come in to see you.
Okay, stop there. All right. So he's had no preparation for that at all. Thank you very much, Dr. Zak. That was very good, actually. We're talking today about dealing with difficult patients. When I say difficult, what do I mean, guys? What does difficult mean? How was I difficult there?
Angry.
How was I being difficult?
Angry?
I was kind of angry. Yeah. What else?
And you thought you
restless patient?
I was angry. I was what else? Not accepting maybe what he was saying, right?
He wants the priority first.
Or reluctant.
Yeah, I was reluctant to go along with him, etc., etc. So obviously the class today is about difficult patients. Really, I suppose anger is one of the main ones, but maybe talking and asking difficult questions, you know what I mean? Not really accepting what the doctor is saying. How do we think Dr. Saki did? What do you guys think? Was he rude in his response?
No.
He was not rude, I don't think. Although maybe there was some things we could improve with some of the things he did. I think in general it was good. What was his instinctive reaction? Does anyone remember the very first thing that he did? As soon as
it must be very difficult.
Yeah, so what is that? What is that, guys?
Empathy.
So is empathy a good thing to do when someone's angry or difficult?
Very good.
Yes.
Very good, isn't it? Okay. Probably the number one thing before you do anything else is you're going to say, oh, that must be really difficult for you. I can really understand that waiting 3 hours is not good. Something like that. Okay. So empathy was good, but actually, when we're dealing with difficult patients, guys, there's many things you can do. There's many different techniques. I think there are at least 6. Last time I did this class, we had 6 different techniques. One of them was empathy. Okay. And what I want you guys to do today is you're going to go into groups. Okay. Maybe you can think of 7 techniques. I'm not even saying that there's only 6 techniques, right? But I want you to go into groups today and you're going to try to discuss 5 more techniques for dealing with a difficult patient, except for empathy, right? We already have that one from Dr. Saki. What else can we do? Don't tell me now, all right? I would prefer it if you go into groups in small rooms and chat about it. You're all nurses, you're all doctors. I have no doubt that you've dealt with angry and difficult patients before. Of course you have, all right? So let's teach each other. Let's discuss what we do maybe in our own languages. I want you guys to come back and we're going to make a diagram of all of your ideas, but also my ideas. I've been teaching OET a long time, so I can give you, I think, very useful advice and tips. Okay, so is that clear, guys? You're going to go into rooms and discuss very quickly. Is that all right? Everyone clear?
Yes.
What other techniques?
Yes.
Okay, so you're going to be in rooms of about 5 or 6. Rooms are opening now. Go into the rooms. You'll have about 5 minutes to chat. Off you go, please. I'll share my screen as well, just so we're clear.
Alan, I'm going to race away.
Okay, no worries. I'll send you a quick diagram with the 6 things we come up with. And
Thank you so much. I would stay if I could, but oh my gosh, I've got one-on-ones and I'm so busy trying to move from here
it
to
was
there.
so nice. Just see you coming in, it was really nice. So I really
Thank you. Thank you so much. All right, but I'll definitely see you Wednesday, but I'll look forward to your email.
Definitely. All right. Take care, Amanda.
All right. You
Bye-bye.
too. Ciao.
Bye-bye.
Thanks so much. Ciao, ciao.
Okay, so I think most people are in the groups now. They'll be discussing this question. That's Amanda, one of the teachers who helps in the speaking club, because we always work in groups and we have more than one teacher. So if you're watching this video online on YouTube, you're just going to have to wait for a few minutes, because these guys are going to discuss possible techniques for dealing with difficult or angry patients. So just wait a few minutes. You will see, I'll leave the recording going, but in a few minutes, you see they will come back and we will give you 5 more techniques, at least. Maybe even they'll teach me something new today. Okay. Okay. Okay, so I think that's enough time. If I could ask you all to stop what you're doing and return back to the main room, we're going to have a discussion about different techniques that we can use, and then we'll have some examples as well. So if you can just stop what you're doing, please everyone return back to the main room, if that's okay. Okay, so I can see you guys coming in. Just hold on a second while we wait for everyone to come back. All right, and then we'll go through this. I'll be nominating individual people here. So we're still waiting for a few people. This always happens, guys, I'm afraid. We always have to wait a little bit as because some people's computers, I guess, are faster than others. So, for example, Hussein is still in the room, but I know that he's probably just waiting for the computer to work. Room 11 seems to have 3 people in it. So, unfortunately, we're just going to have to wait a second, guys. All right. I think that's most of the things. Can you all hear me and see me, everyone?
Yes, loud and clear.
Yes. Yep.
Fantastic, Safi, and it's nice to hear your voice, Safi. So let's start with you, sir, if that's okay.
Yes, yes.
All right, so we're going to make a little diagram here with all of the kind of main things that we can do when we're dealing with difficult patients. I did something like this maybe 3 months ago. Let's see if we can remember what we were talking about. So Safi, give me a technique that I can use when I'm dealing with a difficult or maybe angry patient.
Thank you, sir. We discuss a number of techniques in our group.
Just give us one, please, and we can
Yes,
just go through that.
one of them could be give assurance to the patient that you will be have required services timely.
So assurance or even reassurance, would you say?
Reassurance, oh yeah, reassurance.
Yeah, what's the difference between reassurance and assurance? I suppose they're basically the same thing. So I'll put reassurance here, okay? I do agree. Can you give me an example though, Safi?
As
What
I
kind of
mentioned,
things?
sir, in case of any crowded in the emergency department, we can reassure the patient that if I'm busy currently, we can refer you to another nurse or doctor.
Okay, so that would be okay. And maybe something like try not to worry as well. So try not to worry. I can refer you to maybe
Try not to be panic.
try not to panic. Maybe not trying to panic. That's a little bit strong. Norzad, do you have any? Were you in the same room? What could we say here? Try not to worry.
Yeah, I was not with that group, but we can say like try not to worry. You will be seen, or you will be, I mean, examined, or you will be seen.
You are
I mean,
on safe hand. You are in safe hand.
And
you're in safe.
Yeah.
Even you're in safe hands. Even if obviously, if I'm complaining about the time,
You're in the right place.
Yeah, you're in the right place. You're in safe hands. Okay, so stop there, guys. So I like that. You are in the right place. It doesn't really mean anything, does it? I mean, it's just reassurance. It doesn't really help. But okay, so that's just one thing. Of course, guys, this is just one thing. All right, you need to do many things because if they're very angry, just reassuring them will not be everything. It's not going to help. Okay, so let me ask someone else now. Can I ask to speak to? Let's try someone who's maybe a nurse. Maybe Deanna. I think you're a nurse, right? Could you say hello?
Yes.
Could you give me one more technique? Obviously, we said empathy before, right? So I'll put empathy here, actually. We already discussed empathy. Can you give me another one?
Yeah, we were talking about as well, like getting their input for a solution. How they would like to be helped.
Oh, right. What you mean, like, how do you think I should solve this problem? Like that?
Yeah, how would you like me to help you, or what would you like me to do?
How would you like me to help you? I don't know, because if I'm saying I've been waiting 3 hours, that's not really going to help, is it? Or if it's something you disagree on, you kind of have to, Deanna, you kind of have to say no sometimes, don't you? This might work sometimes, all right, but not, there's going to be lots of situations where that's not going to work that well. Do you have another technique, Deanna?
Yeah, another one. Active listening. Listen to their story.
Active listening. That's exactly what I have on my written down as well. Okay. What is active listening? There's 2 types. What is it?
noting and
Just Deanna, please. Guys, I'm just talking to Deanna, but as Gates, I'll bring you in for number 2. So Deanna, give me one of the types. Like active listening, what does it mean? Example. Oh, we've lost it. Okay. Esgates, do you want to help her then? And Bianca, do you want to help? What is active listening?
Sorry.
Echoing.
I see.
Well,
I see. Yeah.
Pain.
Norzad, go on.
Yeah, you just repeat your pain, like echoing.
This is called echoing. So Esgates, could you say hello?
Hello.
Do you know what echoing is?
Repeating the patient says, yes, you are in pain. Yeah, I see.
So repeat key words.
Words, yeah.
Right. Do you remember in the example, guys, with Dr. Saki, I was saying, why was I angry, guys? Do you remember?
You have pain. You are waiting for so long.
So what words would we repeat back?
Yeah, so long. Maybe, yeah.
Maybe 3 hours. Ooh, pain, right? So you're going to repeat back key words, okay? And Deanna, this is a great, using these two together, right? Some reassurance, some active listening, and empathy. We're now on the right track for actually dealing with this quite well. There's many other things we can do, though. Bilge, could you say hello? If it's all right, Bilge, or if we could have Alice. I know you're a little bit new, or Yasmin. Put your microphone on, please. Yasmin, empathy. What do we mean by empathy? Could you give me some example phrases? What do we say for empathy?
Yes, we could say, I'm really sorry to hear that. Or I appreciate your worries, or I appreciate your concerns.
Yeah, or things like that's quite understandable. Yeah, I appreciate, I appreciate your concerns.
Your patience.
It must have been very painful. Or,
there's so many things, and we already studied this really in the past, but just to get some examples, here's 3 very good examples. Okay, thank you very much there, Yasmin. Can I speak to maybe who else can I speak to here? Ibrahim, can you say hello? Or Ronak, if you're available? Ibrahim or Ronak, come on guys, if I say your name, we've got to. Yes, Ronak. Okay, so we've got empathy, we've got this angry guy. You can give reassurance. Try not to worry. I'm really sorry to hear that. I see. Our pain, right? 3 hours. What else can we do, Ronak?
Well, to be honest, in these cases, I was talking to my group that no one wants to be a patient. So we must definitely show them interest, that we are really, really listening to them, and then try to reassure them. Yeah.
So showing this is showing interest, isn't it? Active listening is exactly right. And assurance or reassurance. But I think there's 6, Ronak. Can you think of another one?
Yeah, and definitely try to help them and tell them that we are doing everything in our hands to help them right now. Just be a little bit more patient. We are really busy now, but
we are doing everything we can. That's reassurance, but it's a very nice phrase. Okay, we're doing everything we can right now. But I'm thinking about a really sort of distinctive technique. How about this, Ronak? Do you have, obviously, stupid question. You have parents, of course, right?
Oh, yeah, of course.
Do they ever get, how old are they? Do you mind me asking? Are they old?
No problem, 70.
Okay. But like mine. Okay, so do you ever, sometimes when my parents are getting a little bit stressed or, maybe even arguing, what's the technique you can use with your parents?
Trying to calm them down, calm down, try to breathe.
What I do, Ronak, is I change the topic.
Oh, well.
And they're so old, they don't realize, right? So I say, oh, remember that lovely holiday we had? And then suddenly not so stressed. Can we do that with patients? Is that okay to do that with patients?
So, I wonder how you can change the topic with a patient who is angry and needs to be treated immediately.
Can't talk about holidays or animals or cats, right? But you can change topic. You can change to another medical topic, right? Yes. So in the example of Dr. Saki, I'm waiting 3 hours, I'm in pain. What topic could I change to? Away from 3 hours. That's a bad topic, isn't it? 3 hours is a long time.
Let's move to your symptoms, please.
Symptoms, right?
We can ask when did it start, or some questions about
start to ask questions. So can you tell me more about your symptoms, right? About your pain, right?
Yeah.
You don't have to treat him, but you can change onto a topic maybe, or pain is a good one, or you could talk about medication, symptoms, you could talk about anything that's taking it away from the disagreement. Does that make sense, everyone? Every OET cue card is going to have a small or a big disagreement. Did you know that? Every single card will have some conflict of some kind. So moving it away from that topic is very, very useful. We'll practice this today, all right? I want to get some more, though. Let's try Teodora. It's always nice to talk to Teodora, or if she's...
Hello?
Teodora, okay, now we've got 4. Can you think of 2 more?
Offer him a drink.
I like that. Okay, so would you like a glass of water? That's not bad, actually. That's quite practical advice. Okay, so offer a drink, empathy, reassurance, changing the topic, active listening. What about Norzad or Mohammed? Can you guys think of anything else?
Please, explain the situation.
Apologizing.
No, just Norzad first, please, Mohammed. So explain, right? Of course,
actually, explain the situation, the reason why it is delay. In this case, maybe you will accept it. Maybe you explain that there are other patient with a heart problem. It's very urgent or emergency, or there is injury patients.
Exactly.
And after management of those patients, I will come or my colleague will come and deal with you. Explain the context, the situation. Then maybe
exactly right. So, and I'm going to add something else on here, Norzad, just because it's more natural, I suppose, to add it. Before you explain, maybe you can apologize a little bit. You have to be very careful with your apology, right? We'll talk about this week. Obviously, be careful with apologizing, but I think it's not a bad thing in general to apologize. So, Norzad, you could say sorry, but the reason why, something like that.
I understand your situation, but
the reason why you have been right. Okay, so does everyone agree with Norzad here? It's very simple, isn't it? But it's very good to do it, I think. Give a reason. Okay. So now we have, I'll take questions in a second, but now, guys, we have 5 techniques: changing the topic, reassurance, empathy, active listening, and apologizing. Can I just ask a few more questions, though? Bianca, could you say hello?
Hello.
What's the difference between empathy and reassurance? Because sometimes students get confused between empathy and reassurance. We have empathy here, reassurance here.
Empathy, just you say that you are sorry and you are empathize with them, but with reassurance, you gave to the patient. It's like you build the trust. We are here to help you, and you are in good hands. So
what are we removing here? We're removing we're reducing. What are we reducing?
Reducing
anxiety, worry, right? Yeah. Anxiety. Okay, so with reassurance, we're just trying to reduce anxiety in general. But with empathy, Bianca, you use the word empathize, which is the same. Can we have what does empathy mean, guys? Empathy
sharing the feeling.
Sharing feeling. There we go.
In the patients.
Okay, now Bianca, can you think of another thing that we can do? Maybe one more.
I agree with apologize, but maybe we can agree with them and then explain the situation.
Possibly agreeing is not bad. It depends on the situation, though, doesn't it? Sometimes you can agree, but for example, in the thing that we are going to do in a minute, Bianca, we're going to have to say no, you cannot eat before surgery. So you can't really agree and say yes, you can eat.
We use contrast, maybe,
Ooh, contrast. What do you mean? Go on, contrast.
I can see that you really want to eat that thing, but in this situation, it's better for you to refrain from eating because it may be worse because the procedure, blah, blah.
So that's really explaining, though, isn't it? And I'll put here, though, you are right, consequences, right?
Yeah.
Giving consequences like, if you do this, then this. That's going to be very helpful. Okay, I'm going to open up to everyone. Can anyone think of one more? It's more like something that you shouldn't do. Can anyone think of something you should avoid doing?
It's to interrupt. At a point, you have to interrupt him because
no direct no's. Never say no.
We'll talk about interrupting in a second. What I'm thinking about is no's. No direct no's.
Never say no's.
Be non-judgmental.
No, you can't do that. Should you say that when someone's angry?
No.
Should you say, that's bad? No.
Be
You will
not
never be able to do that.
Sorry, Ellen, can we do a joke with the patient? It's not a good way.
Okay, go on. 1 second, guys. So that's just to calm it down a bit. So for a joke, if you can, if you're funny and you can sort of think of a can you give us an example of a kind of joke? I mean, that's more like very, very high level. You know what I mean? Good, very good social skills if you can do that. Could you give me an example? Do you normally make a joke with your patients sometimes?
Sometimes, yeah, it happens that a patient is sad. I mean, angry, and you make a joke to make that person laugh. So sometimes it's affected that patient. So sometimes it's negative, sometimes it is positive.
I definitely think if you have a good joke, good idea, depending on the situation, I think it could be very, very positive.
But we don't know about the patient, if it's the patient likes it or not. So we have to avoid it. Yeah?
It's a bit bespoke. But why not? I mean, you guys are very experienced medical professionals. Why not if you can think of a good, safe joke, right? I think these are the main 6 things that I want us to practice this week. Now, does anyone else have anything they want to add or ask me a question?
Alan, I have a question.
Yes.
Yeah. So in case they are very confused and they are very disruptive and angry, how would you deal in that complex situation?
Well, what I'm saying to you is that you only really have these 6 ways. I cannot think of any other ways. Can you? Suthan, are you there?
Could you ask for help?
Yes, sorry, I think my connection.
Oh, it's okay. It's okay. Can we ask for help? Okay, so I'm talking about the OET exam here. So no, you can't ask for help, all right? I'm talking about techniques that we can use in our exam. In real life, you could ask for help. In real life, you can make a joke. In real life, you can do those other things. But I think in the OET exam, these are the best 6 things, all right? We're going to practice them.
Understanding?
Question. Yes, me. Go on.
Could we check understanding? Could we add check understanding?
Do you think that would be wise if they're angry?
No.
So, for example, I've been waiting 3 hours.
After apologizing and explaining.
Let's try this, Yasmin. Yasmin, you're going to check my understanding, right? Yasmin, I've been waiting 3 hours. I'm in terrible pain.
Oh yeah, I'm so sorry about that. But you see, it's very busy here, and I will get someone to see you. Is that okay with you?
It's not okay with me. I'm totally not okay. So were you trying to check my understanding then? Is that okay with you? That's really not a good idea. Is that okay with you? And if you say, is that clear? Even if you say, is that clear? Again, I think that just doesn't really, it's not going to make someone less angry. It might not make them more angry, but it is risky, okay? But Yasmin, you immediately did these things that I've been saying anyway, right? You started by doing what I've been saying. I don't really think there's any more, unless I would love you guys to teach me another one that we can use. Yes, go on, Mary.
It's Mary. In the 3 months ago, we discussed this case that patient was insist to eat some cake before operation. It wasn't allowed, and you suggest ask them the question that what do you know about the risk associated with eating before operation?
Exactly. That is changing topic.
Yeah.
Right. So. Sorry, I should have made this a bit more clear. We will practice this. Changing topic is about asking a question. Is that clear, guys? Right? I'll show you an example of this now. But sorry, Mary, what did you want to add to that? Sorry, I didn't interrupt you there.
Yeah, it was just like this, that how to practically do this. Just ask question, and a patient when start to answering, it will be the good chance to change the topic, to calm down them, because people cannot answer the question and be in the same time.
I mean, Look, I'm not saying you have to do all of these. I'm just saying these are the only 6 ways I can think of that are practical, right? They're solid ways. So changing topic can work. It can be very effective sometimes with questions like, Mary, give me another example of a question that could change topic. Can you?
For example, what do you know about risk associated with eating before operation? It was that one.
So this is quite a clever one, isn't it, guys? Because we're changing the topic to risks. How is that helpful to change to risks?
Because patients start to think about this. I am in risk.
Yeah. So you can move the topic onto, if you're going to be very, very clever about it, which is we're going to talk about a bit later. You can change the topic to something that will help them to explain it. You know what I mean? So we'll talk about these things because we're going to have an example now. But I just want to leave space for anyone else to add anything. I was hoping that I would get a number 7 from someone. Does anyone have something that's
teacher.
Practical? Yes, go on.
When we start complaining, for example, waiting long time, first of all, you should agree with patient. Then apologize, then explain the reason why you are late.
Yeah, so when you say agree, right, that's no negatives. I'm just looking at the negative side. Don't disagree is what I'm saying. Apologize, as you say, definitely, and explain, act out. It's already here, all right? So I think those things are very, very good, and we're going to practice them today. We can see specific individual things as well. Go on, Bianca.
What about the phrase, okay, the patient insists a long period, and you can say, but before going any farther, may I ask you some question or something?
Using structure. Okay, so let me think about that. Okay, this is a good. Does everyone understand what Bianca's saying here? She's saying, before we go any further. What does that mean, Bianca? Before we go any further?
Before you continue to complain a lot.
So I think that's a sort of topic change. It's a very good way to do it there. So before we continue with this issue, you could say, for example, and then plus question. I think, I'm not trying to say that this is the only possible way, guys, but I can't think of any more. I think these 6 are probably the good ones for us to check this week. Now, and I know you've got. Go on.
Can we explain for them, for example, in the delivery room when the pregnant woman has pain, but we are busy with the other patients? Can we explain how to take breathe in to relieve the pain, for example?
It all depends on the situation. Yes, a lot of these examples are good, like making
it will help for the patient.
Like this. And but it depends on the situation, that kind of thing. All right. Whereas these 6, I think you can probably do these 6 in almost any situation. For example, you're not going to use negatives. Any situation with angry or difficult patient, do not say no. Does everyone agree with that? You know what I mean? It's not only some situations. I'm not saying that you cannot say, you have to use different language, okay? But let's look at a specific situation. We'll come back to this, all right? And we'll look at a specific situation. Has everyone seen this card before? It's a very famous card. I'm choosing a very easy one. Probably everyone's seen this. Have you all seen this?
Yeah.
Has anyone not seen this before?
No, me.
Okay. So
No.
we'll quickly review.